Hello, my name is Axel Hauschild. I'm a dermato-oncologist from Kiel, Germany, and it's a pleasure to talk to you and to highlight some of the findings here from ASCO 2019 in Chicago. The first study I want to mention is the meta-analysis of a neoadjuvant trials. 6 of the trials have been analyzed, and the pathological complete response rate, particularly of ipilimumab and nivolumab, was almost 70%, so very, very good data. And also for dabrafenib and trametinib, it was very good in the same range. But it turned out after the long-term observation with some longer follow-up that the patients with targeted therapies are less likely to have a long-term benefit compared to ipilimumab and nivolumab treated patients. So the benefit of the immunotherapies in the neoadjuvant setting was even better, and none of the patients, despite a long-term follow-up, has progressed so far, and all of the patients are alive. That is something which is really outstanding, and I believe the neoadjuvant trials will make a difference in the future. So in principle, operable patients could be treated by a systemic neoadjuvant treatment, and then surgery comes into place. Second trial I want to mention is a trial which is called the pre-trial of Combi-I. It's dabrafenib and trametinib, a BRAF and MEK inhibitor combined with spartalizumab, a new PD-1 antibody. And this trial turned out to be very exciting because the response rate is as high as more than 50%. But new is, it's not 50%, it's 78%. But there is a 42% complete response rate. This is the highest complete response rate I have personally seen in the last 30 years. So very exciting data, and the phase 3 trial on this combo, it's a triple regimen, is already underway, and another one by cobimetinib, vemurafenib, and atezolizumab as well. So hopefully by the end of the year we will have the release of 2 pivotal phase 3 trials who can make a difference and define a new standard of care. And also I want to mention the 5-year overall survival data of dabrafenib and trametinib, pooled data from 2 randomized clinical trials, namely Combi-V and Combi-D. Excellent data, and the 5-year survival is 34%. The progression-free survival after 5 years, 19%. So very good data, no new safety signals. Also some of the exciting news, the results will be released tomorrow in the New England Journal of Medicine as a full manuscript. And lastly, I want to mention a combo of nivolumab, a PD-1 antibody, and a pegylated interleukin-2, which is a component called NKTR214. And also here you have a response rate in a range of 50%. I thought it was 52 or 53%, but the exciting stuff comes from complete responses. 32% complete responses is a lot. Also, a phase 3 clinical trial has been initiated, and hopefully this clinical trial will show an additional benefit to a conventional PD-1 treatment with nivolumab. So this is just to mention 4 of the trials which have been shown here at ASCO. I'd like to thank you very much for your attention. Obrigado.